If you want to learn about psychological growth without getting lost in complicated language, you're in the right place. This is the Relational Psych Podcast. I'm your host, Dr. Carly Claney, licensed psychologist and the founder and CEO of Relational Psych. On this show, we learn about the processes and theories behind personal growth. Please keep in mind that this podcast isn't a substitute for therapeutic advice, but we're here to point you in the right direction. Well, today we have Erin Wright. Erin Wright is a consultant, supervisor, educator, coach, and psychotherapist who specializes in psychedelic integration in Seattle, Washington. She has completed training in MDMA assisted therapy through the Multidisciplinary Association of Psychedelic Studies and has training and experience in ketamine assisted psychotherapy. Erin is co president of the Northwest Alliance for Psychoanalytic Study and on the board of the International Forum for Psychoanalytic Education. Erin, thank you for joining me today.
Yeah, I'm really happy to be here. Thanks.
Yeah. So, the question that we're going to be talking about is what is going on with psychedelics? And I feel like there's so much to say about it. So, where should we start?
Yeah, I think it's important whenever we're talking about something, especially in the mental health field, is to give a little background on how we got into something. I had a really amazing supervisor one time. I think she's actually been on the show, Rachel Newcomb, who, yeah, I love the stance she holds that all theory is autobiographical. And I think that is really important so we know where people are coming from as they present information and talk about things. So I'll just talk real briefly about what drew me to an interest in psychedelics. Kind of two things are happening at the same time. I was working with a client that I had been working with for quite a while, and they started experimenting with psychedelics on their own. I used to work in an emergency room, so I kind of saw the dark side of drugs.
Sure.
And came from this stance of all drugs are bad because of
Uh-uh.
what I had seen in the ER. And when I think about it now, most of the things that came into the ER were not psychedelic related substance
Mm.
emergencies. A lot
What
of
were they? What did you see?
a lot of meth, a lot of meth use, heroin overdoses, but the main one was meth that we
Mm.
would see a lot of coming into the ER. So I kind of had that bias coming into this work. And then this client started bringing some of their experiences up. And I was really amazed at some of the insights they were coming to around exploring these substances. And they had been doing really good work for a long time, but it was like they were starting to finally get some things on a really felt level. I think that work that we do in therapy, trying to bring things down and really change people's affective responses and nervous systems, it seemed like that was really happening with this client around some things. And so I was like, wow, this is actually really incredible. So I started getting interested in it from that. And then kind of alongside that, I have been doing my own work for a very long time. Done a lot of good
Therapy.
yeah, therapy. Yeah. So done a lot of good personal work that I am really proud of. But I kept bumping into things in my life that just didn't feel great to me and were really impacting my life in really significant ways. And someone who is really close to me, has known me for a really long time and really knows my journey and story really well, was like, Erin, I was, talking to somebody the other day about psychedelics, and I just couldn't help but think of you as I was talking to them about this. And so that led me to exploring these things on my own for my own personal use. And they had a really tremendous impact on me and my life. And I was like, man, this is really incredible. And so then I just kind of jumped in from there into learning more about things. So
Yeah. Yeah, that's incredible. It seems so significant to both see it in a client's life, especially the work that I'm guessing you do, the depth-oriented work where you know people really well. You know what's the work that they're doing to really get to know themselves and sit with themselves. But it sounds like it was a move from that insight, like just kind of in their head. And once they started the psychedelic work and the integration with you, if that is what it was at the time,
Mhm.
then they really were in their body, not just in their head. And then maybe a similar thing for you. You got to experience it. And I think it's always really amazing when people who know us really well can make that kind of recommendation. It can be
Yeah.
so scary or overwhelming to start something brand new, especially like psychedelics. There's so much, I don't know, feeling about it. There's so much fear around it
Mhm.
or questions or unknowns because it's so new.
Mhm.
And so to have
Mhm.
someone to bring you into it in a way that might make it feel a lot more approachable and personal for this will be
Yeah.
helpful to you.
Mhm.
So then it sounds like you got started on education. And what did that look like?
Yeah, so I kind of started just gobbling up things
Mm,
wherever I could find them. I used to run for about a year and a half or so. I used to run a healthcare professionals networking group
mm,
for people who are interested in learning more about psychedelics. So I brought a group of people together for a while to network and learn more. So I was doing that. And then the Multidisciplinary Association for Psychedelic Studies, MAPS is the acronym for
mm,
that.
mm.
They were doing an MDMA assisted therapy training program. So I applied for that program and got accepted and went through that training to kind of learn more about MDMA and what kind of the model that will likely head towards legalization here in the next couple of years. So that was the main thing I was really interested in. I'm really interested in PTSD, and there's so much trauma in our world in so many different ways. And I think MDMA is a really incredible medicine to help people work through trauma. So that's really what drew me towards that one specifically. And then also pursued training in ketamine assisted therapy and was doing that for a little bit until my clinic closed. And what drew me to that was it's legal now. So people can go get ketamine now. And I wanted to have some of that more legal sitting experience with people at the time.
So I think we've listed a lot of different names so far, a lot of different psychedelics. Can you give me an overview of what we're talking about there?
Yeah. So MDMA is what we call an empathogen. The long name for it is 3,4 methylene dioxymethamphetamine. So it is an amphetamine. It is a
Mhm.
stimulant. It's been around for a long time. It was actually first developed through a pharmaceutical company called Merck in Germany in 1912 and then really wasn't paid much attention to at the time, and then was resynthesized by a chemist here in the US in the 70s. His name is Alexander Sasha Shulgin. He's not alive anymore. So it made an appearance then in the US. And really, MDMA, what a lot of people don't know, was legal here in the US for a long time until about the 80s. I think it was mid 80s where it got outlawed, but you could go into the bar and order a drink and a tablet of ecstasy.
I had no
I
idea.
know. Yeah. So that's MDMA. And then ketamine is what we call a dissociative anesthetic and has been around for a long time. It's actually considered an essential drug by the World Health Organization because it's a very safe drug. It's cheap. It's been used by the military in battlefields for quick
Mm.
medical use, but what they eventually found was that given in low doses, ketamine can produce psychedelic effects.
And can you
So,
even define that? What does that mean to have a psychedelic effect? What's that?
yeah. So, whenever we talk about psychedelics and usually how they're working, this includes ketamine, what we often refer to as the default mode network. And basically, what that is a network in your brain. I'm going to put it in real simple terms here. We all have kind of these neural pathways and grooves that have developed in our brain over time, often due to life experiences that we've had. So, there are ways, there are tracks in our brain that we see the world through. And it can be hard to get out of those, right? And that's
Mhm.
often what leads people to therapy. And therapy works with that, but it takes a very long time.
Mm.
And what psychedelics do is, including ketamine, is turns down the default mode network in the brain and helps parts of the brain talk to each other that haven't either communicated in a really long time or maybe haven't communicated it before. And so they turn down the tone on that default mode network and help us maybe get some access to some other ways of thinking and experiencing things.
Mhm. So rather than maybe just one map, I'm thinking of like a road with grooves and all of that. Is it possible to think that it becomes three-dimensional? There's, like, different variations that rather than what you're seeing, there could be, like, a bridge between that's not actually there or a different path. Is that visual, or how would you change that?
It can be visual, it can be insight, it can be a different affective way of experiencing things. It could be a different way of experiencing something in the body that you haven't experienced before. It can look a lot of different ways. Yeah.
Mhm. But it's just a different thing that it wouldn't come from you originally. It wasn't a part of your original map road that you've experienced before.
Right. So, one of the things we are doing in therapy is trying to help people have different ways of experiencing things or thinking about things. Sometimes one of the things we're doing is maybe having that corrective relational experience as well. So, we're trying to really help people, we're trying to help people rewire their brains in a way, right? I mean, there's a
Mhm.
lot of neuroscience behind that. You think about Dan Siegel, the developing mind. That's a lot of the work that's happening in therapy. The way I think about psychedelics in this default mode network is psychedelics are kind of a supercharged way to do that kind of work. And it
Mhm.
often goes a lot faster, which can be really good, but can also be difficult for people as
Yeah,
well. Yeah, which is really why it's really important for people to have really good supports while they're exploring using these medicines. Yeah.
for sure. Okay, thank you for that side tour because I think that's helpful to even know what we're talking about when we're thinking of
Mhm.
psychedelics. And I interrupted you at ketamine, so we talked
Yeah,
about
it's okay. MDMA, ketamine,
yeah.
and then you have what's called your classic psychedelics. So that would be like psilocybin, which is the psychoactive ingredient in magic mushrooms. That
Mhm.
would be LSD, DMT, which is the psychoactive ingredient in ayahuasca, and then another compound called 5-MeO DMT as well.
Mhm. And so that all those that you just listed, those all are types of psilocybin.
No, so
Oh,
psilocybin is just the active ingredient in magic mushrooms. So
uh,
psilocybin is just mushrooms by itself. Yeah.
okay, okay.
Yeah.
So
And so the way those differ for something like MDMA or ketamine is the way that they work in the brain and the different receptors they work on. So your classical psychedelics are going to be a bit more visual in nature and they work on what's called the 5-HT receptors in the brain, whereas something like MDMA is working more on how they think it works is turning down the smoke screen on the amygdala. It turns on the body's fear response and is more releasing chemicals like serotonin, oxytocin, and dopamine into the brain, which creates this really safe feeling. And then ketamine works on the glutamate system in the brain.
thank you. I think that's a really helpful outline of all the different substances we're talking about. And I think you did a little bit of this of bringing it back to therapy, bringing it back to what is it like, why are we even thinking about this in therapy? Why
Mhm.
has the field expanded in this way? And maybe to get a little bit of that history, why are we talking about this now?
Yeah, so there was a ton of psychedelic research going on in the 50s and 60s. That was really what we would call kind of the first renaissance or the first golden age of psychedelic research. There's lots of stuff going on with LSD, especially. A lot of people don't know this, but one of the primary ways Bill White, who's the founder of Alcoholics Anonymous, got sober was through LSD.
Oh,
Yeah. And so the board, the AA board wasn't exactly on par with all of that. And
mhm.
so they wanted a like very complete sobriety model. So that part kind of got quieted a little bit in the history, but LSD was a huge catalyst and what helped
Wow.
Will White get sober. Yeah, so there's a lot of great research happening. And I really think until psychedelics started becoming outlawed and made illegal in the 70s, which was a broader war on drugs that started happening. I really think we might be doing therapy differently now if those medicines hadn't been illegal and they were placed in Schedule 1, which if you're familiar with the drug schedule in the US, so the Drug Enforcement Agency basically schedules drugs in the US into Schedule 1, 2, 3, or maybe a 4, I'm not sure. But psychedelics were put into Schedule 1.
Mhm.
Schedule 1 means highly addictive and no accepted medical use. So
Mm.
once they were put into that category, all research had to be shut down.
What else would be in that category today?
Marijuana is considered a Schedule 1 substance.
Oh,
So methamphetamine, which is wild if you think about it, opiates are not in Schedule 1.
oh,
Ketamine's a Schedule 3 drug, so it can be used accepted medically. Really, I think what it points to is how the war on drugs and drug scheduling in this country is more related to politics more than any actual science. Something like mushrooms and MDMA, they are not what we would call like physically addictive. So you're not necessarily going to experience withdrawal symptoms if you use mushrooms and MDMA. Now, can you abuse them? Yes, for sure. That can definitely happen. But if you think about something like alcohol, which is not in Schedule One either, if you think about how alcohol, if you drink too much, you can become physically dependent over time. You can experience withdrawal to where you need medical detox. With these psychedelics, I think the bigger risk is maybe more of a psychological addiction where you kind of become addicted to the experience of itself because these can be some really amazing experiences and somebody just wants to stay in that space all the time. But they're not gonna necessarily get your body hooked on them.
Uh-huh. Yeah.
Now, if you do abuse them, something like MDMA, if you abuse that frequently over time, it can deplete the serotonin system in your brain to where you can develop like chronic depression over time because if you abuse this. I mean, we're talking about like chronic use here, like every week or something like that. I wouldn't ever recommend somebody do that. So,
Yeah.
yeah.
Yeah. So yeah, I think that's helpful. Even abusing, we're talking about every week. Is it also how much you're taking at once?
How much every week? It's like any other substance, there's potential for abuse. Yeah. Yeah.
Mhm.
So if we come back to therapy now, Matt started doing a lot of their own research and started up the MDMA trials for MDMA assisted therapy for PTSD kind of in the late 90s. And they've spearheaded a lot of that research, MDMA for PTSD. So now we're in what people would call kind of the second psychedelic renaissance, where there's been a lot more research going on. I think the important thing to note, though, is the research that's happened has primarily been funded by private money,
Mhm.
which really limits the size of the trials that
Mhm.
can be done. And what a lot of people maybe don't know is that most of the medical research in this country is funded by NIH, which is the National Institute of Health. And there was a period of time where the only clinical trials involving psychedelics NIH would give money to would be trials that were basically showing them as dangerous. So they did just issue, I think in the past year or two, they did finally give some money to do a study for psilocybin for tobacco cessation
Hmm.
as well. So they did give some money for that. So I'm hoping that they'll show some willingness to fund some more of those
Yeah, good.
studies. Yeah. Yeah.
Yeah. Yeah, it's interesting. Why is there that connection between psychedelic work and trauma?
So, like, how can psychedelics help somebody with trauma, or why has maybe it been effective with trauma?
Yeah, I think both. Like why it got started in the first place, making that
Yeah,
linking, and then yeah, how it helps.
yeah. So I think let's talk about MDMA with that because those are the studies that have been done specifically for PTSD. MDMA is a pretty incredible medicine, and and you'll hear me use these terms interchangeably, medicine and drugs.
Mhm.
I prefer to use the term medicine, but because I have grown up in a society that, uses the term drugs a lot, it will come out from time to time. But I really think these are medicines because they can help people in really incredible ways. So MDMA is really helpful with working with trauma because if you think about trauma, one of the things that causes PTSD is that feeling of the trauma still happening in the present. And it can be really difficult for people to maybe go back and look at traumatic memories and stay within kind of that window of tolerance where they don't maybe get re-traumatized by revisiting those things because as we know that's kind of part of trauma work is being able to go back and revisit and affectively experience some things to try to put that back in the present to help the nervous system know that we're safe now and life can go on. It can be really difficult to do. It can take a really long time. And I don't want to say that we don't have great therapies now for trauma because there's many different ways to heal from trauma. And I definitely believe that therapy is one of those things that can help people. But where I think MDMA is really incredible is because of the way it works in the brain, right? So turning down that amygdala, turning down the smoke screen, it allows somebody to go back and revisit traumatic material without getting overwhelmed. So MDMA
Mhm.
creates this really beautiful cocoon that helps somebody feel safe and they can go back and look at those things in a way that they might not be able to in regular therapy.
So
Yeah.
it sounds like they can stay within that window of tolerance. Their body stays regulated while they're exploring the memories and thinking about it in different ways.
Yeah, I mean, it can stay regulated. That's not to say that people don't have a difficult time during the experience. That's where having a really good psychedelic therapist or guide can be really helpful in those moments because it can get a little overwhelming, but it creates we call this inner healing intelligence. So there's this idea, and let's say you get a cut on your arm and you go to the emergency room. The doctor at the ER, he or she doesn't necessarily directly heal the cut. What the doctor does is they provide the optimal healing conditions for the body to engage in its own natural healing process. So that would be giving medicine, giving antibiotics, giving stitches. And once those things are done, the body will then heal itself over time. So the idea is the same thing with the psyche.
Mhm.
So if we can create the optimal healing conditions, we all have inside us, I think, the ability to heal ourselves and that we really do know what's best for us and what we need. So the idea with MDMA is that because of how it works in the brain and because of the kind of safe and feel good conditions it provides, it makes it safe enough for somebody to revisit the things that they need to, that they haven't necessarily been able to before.
Mhm. I love that approach or that emphasis that the body is doing the healing, that the body always
Mhm,
is doing its own healing, whether it's
mhm,
physical or emotional or based on just the psyche. And I think that's a really good image of clarifying it's an environment that's created similar to environment
mhm,
create in a therapeutic relationship, but in a different way in the body's system in order to really facilitate that healing.
mhm. Yeah.
What about the people who say, "I can't be healed. I'm too broken. I'm too messed up. I the system that could have healed itself is, like, broken."
Well, I think all of our own healing journeys take their unique paths. The way I would think about that is there is something about that narrative that is doing something for that person. Right. That narrative is, if you want to think about it, I'm not trained in IFS, internal family systems, but it does make me think of either internal family systems or maybe psychoanalysis who thinks about us having multiple self states, multiplicity of the self. That part is showing up, I think, because it's protecting something inside of that person. And so, for whatever reason, that narrative is helping that person stay safe or help them feel safe enough in the moment. And because something different feels too unpredictable or too unsafe or might disrupt things too much.
Mm,
So I think that person could be helped by psychedelics, but there might be a lot of work to do beforehand as far as like letting go of some of that
mhm,
narrative and being open to something different. And you don't want to rush or disrupt that process. I think
mhm,
if you throw people into psychedelic experiences without good enough preparation work beforehand, or if they're in a place where maybe they're not 100% on board or don't know if this is really going to work, but a part of them is like willing to try it. That's a little different than the person who's, this isn't going to work for me. So I think we cannot rush people into these experiences or recommend them if the psyche's just not ready. They're not ready yet. And that is okay.
mm,
That is okay. Yeah.
mhm.
I want to have a lot of grace for that narrative too.
Yeah, I appreciate that because I think there's something that feels really, like, cool and edgy about psychedelics.
Hmm.
And as a therapist, I've felt the pressure sometimes if I'm not immediately on board and understand it and on the cutting edge of something that's so shared to be so amazing, then it really feels like I'm uncool. Like I'm not like there's something I'm missing about like a cool factor because of I don't know, maybe because of that edginess. And so I hear from you like it's for one, it's not about that. It's not about coolness
Hmm.
here.
Yeah.
Um, but I can you talk a little bit about that thoughtfulness? Should everybody be doing it? Should we all be excited? Is there concerns here? Is
Mhm.
there like how do we think about it?
Yeah, it's both a really exciting time for psychedelics. I think there's a lot of excitement, there's a lot of hype, there's a lot of, wow, these things are really amazing, which I think is true. I think what is also true is we're losing a little bit the fact that psychedelics are not a panacea. They
Mm.
do not heal everything. They do not fix everything. And they are certainly not, I'm going to take a pill or do one journey and my life is going to be completely different. And I'm never going to feel this depression that I've felt for 20 years of my life ever again. So I
I
think
feel
it's
like a drop in myself about that, of all the disappointment of that lesson, learning that lesson again and again. It's not just a quick fix.
right. And I think that's so hard in our culture, right? Like
Yeah.
we live in a culture that wants the quick fix, that like we don't like suffering, we don't like pain, which granted makes sense. And those are maybe also parts of life too that we got to learn how to integrate and deal with. So yeah. So I will say who shouldn't do
Mm.
psychedelics. So there are rule outs and contraindications to psychedelics. So first one, maybe it would be if you've had a family history of psychotic disorders. So, I would say probably more an immediate family member. So mom, dad, sister, brother, maybe even grandparent who has had like a diagnosis of schizophrenia or some other major psychotic disorder should really be careful when thinking about using psychedelics because they could trigger a latent psychosis
Mm.
um, in people. So that's one of the screening things in the clinical trials that you need to and that everybody should be aware of.
Mm.
Um, Dissociative identity disorder is another rule out for psychedelics. And then there's medical issues as well, like people who have heart issues shouldn't use MDMA. You also have to be able to tolerate going off psychiatric medications for
Uh,
a lot of these meds. Yeah. So you don't want to use MDMA and be on something like an SSRI because of
mm.
the risk of serotonin syndrome. So you can risk death doing that.
Mhm.
Now, the only one you don't have to is ketamine. Ketamine is actually safe to use in conjunction with most psychiatric medications. There's some that can affect how ketamine works. So it's always important if you're pursuing ketamine to make sure you talk with whoever the medical screening is about what psychiatric medications you're on so they can advise if you're on lamotrigine or something like that, if you need to skip some doses around your ketamine
Mhm.
experience. So heart problems. And then with psilocybin, you can be on an SSRI and use psilocybin, but the SSRI is going to blunt the effects of the psilocybin.
Okay.
So it's just kind of unreliable and unpredictable as to whether or not you'll respond to it. So that's why in the clinical trials, people have to be able to tolerate going off the psych meds
Mm.
for that.
Mhm.
Yeah.
Okay. So those are reasons, contraindications, reasons why not to go at it. Is there
Mhm.
anything that a person who might be listening right now is, well, when would I pursue it, or what should be going on inside of me to think that this could be helpful?
I think people who haven't found improvement from all other treatment interventions, so that it's kind of that feeling of like they've been exhausting everything, like they've exhausted medications, therapy, a lot of other treatments, and just feel like they're not getting enough out of it. They could find psychedelics helpful. People with PTSD, chronic depression, anxiety, I think they can be really helpful for people seeking personal and spiritual growth or for someone who chronically feels stuck in their life or end of life anxiety or depression can be helpful for that as well. I'm not a huge fan of some of the personality disorder diagnoses like borderline. I think really what we're talking about there is complex trauma and complex PTSD. But somebody who has a really hard time in relationships and thinks of the world extremely black and white and can't maybe tolerate a graying of boundaries really might think twice before utilizing psychedelics, just because it could be difficult for them to get into a space where they feel safe enough with a guide or a sitter or psychedelic therapist. And not to say that it can't be helpful for people like that, but I think they really probably need to work with somebody who's really skilled, really trained, and really good at doing a lot of preparation work with that person beforehand.
Yeah, it sounds like this is always going to be a specialty. those guides that you're mentioning, and yet there's instances where even like a more specialty within it would be really important.
Yeah, there's a lot of people who are really desperate for help, have been suffering a really long time, and are going to do what they're going to do to get a psychedelic experience. And I can certainly understand that. And everybody deserves to have access to healing and healing experience. But there's some things that I think are just better in more of a controlled setting where we have really good systems of support in place to help somebody. I don't wanna encourage anybody who has that in their mental health history or has a family member, like a direct family member, to use psychedelics. I'm just saying, like, there could be a potential in the future. I think if these things do get legalized for medical use, to maybe run some clinical trials in some very controlled settings where that person has excellent support through psychiatry, therapy, and other things, to be able to safely experiment.
Yeah, but I think that just emphasizes we just don't know. There's a lot of
Right.
thoughts that of what could happen, but something like
Mhm.
that where there's such risk involved, the research just hasn't been done yet.
Yeah. And I think especially too, with something like psychosis, back in the 50s and 60s, part of what they were using psychedelics for was to see if it could mimic something like schizophrenia, to see if they could find better ways to treat schizophrenia, which I think
Huh.
is really fascinating to me. Yeah, or
Mhm.
they were using it to try to understand better. But the reason why it's a rule out is because people with psychotic disorders often are really open already
Mhm.
and really sensitive to the world around them, to where psychedelics would open them up in a way that even further, that is, they can't collect the pieces and put it back together because it's way too open. That
Ah,
makes sense.
yeah, I'm thinking someone experiencing psychosis is maybe seeing things or hearing things that aren't there. And if
Mhm,
that's part of what the experience of, let's say, a psilocybin
mhm,
is allowing the brain to imagine things or see things or hear things that aren't there, there's like a where is reality? And coming back to that integration piece that you're saying,
mhm.
it seems like there'd be a lot of confusion about where the line of reality is. How would
Yeah.
you change that? Is that the right way to think of it?
I wouldn't say confusion, but just that the openness would be too overwhelming, and there's not a way to collect things and be able to operate in the world as we need to.
Yeah. We've alluded to this a little, but what is the process? What does integration mean when we talk about psychedelic integration?
Integration can look a lot of different ways, but basically, it's somebody taking what has come of their psychedelic experiences and then thinking about what is that experience potentially saying about their life and either changes they need to make or new insights, and how do they incorporate those things and make movement in their life. So that can be taking things to therapy. Like, all of these things came up, and now I'm trying to sort through, what does this mean? How do I feel? What do I do with this? How does this impact me relationally? You can take that and discuss it with your therapist. Somebody else might be like, oh my gosh, like, I felt more connected to my body during this psychedelic experience than I've ever felt in my life. I'm not in that experience anymore. I might feel a little more disconnected from my body, but maybe now I'm going to go do some somatic work with a trauma informed massage therapist to help me become more connected to my body in everyday life, because I had that experience during my psychedelic journey and I want more of that. Right. Because we can't stay in the psychedelic journey all the time. So we got to figure out a way to take bits and pieces of that and do the work. I think integration is the most important part of any psychedelic experiences, because that's where the lasting change is going to happen for somebody. I think psychedelics kind of opens a window to the change that's possible, but it's up to us to put in the work afterwards of making those changes in our life, which can be hard for some people.
Yeah, I imagine it'd be hard if you wanna stay in that experience or if it's just really complex and you don't know how to
Mhm.
make sense of it. So if someone was really interested in this, if someone wanted to access these experiences now, how do they go about it?
Yeah, I think there's a lot of different ways to do that. So ketamine is legal right now. There's a couple different ways ketamine works or is able to be accessed. There's a few different models. One is what we call a strictly medical model. So you'll see a lot of clinics in the area offering like ketamine infusions. And what kind of how this model works is you go and get the ketamine infusion and
Through the
the
blood?
yeah, so it's through an IV. Yeah, so an infusion is through an IV. And the idea is that the medical properties of ketamine can give somebody enough of a shift and enough of a lift to maybe give them some space from some really difficult feelings to start getting some traction and maybe making some changes in their life. So ketamine is really effective for something like what we call treatment resistant depression,
Mm.
where somebody's tried everything and is still stuck in these really deep depressive episodes. So it can be really helpful like that for that. So that's one way to do it. The other would be through pursuing ketamine assisted psychotherapy. And that model is a little different. So what you're doing is you're taking ketamine with a therapist and they are there to accompany you throughout the journey and like discuss what their experience was like during the session and start putting together the dots around, oh, what is this saying about my life entering into integration? And I think whether somebody is doing ketamine assisted psychotherapy or they're pursuing that medical model, everyone who's going to a ketamine clinic needs to ask the question, is there somebody going to be providing support for me in the room the entire time? Because some ketamine clinics will assign one nurse to three patients at a
Mm.
time and might be in and out of the room, which can leave people feeling alone, especially if they're having a really difficult time. So that's a really important question to ask any ketamine clinic that you're thinking about going to do. There's also some psychiatrists will prescribe something called Spravato, and that's called that the name of that is S-ketamine. S-ketamine has actually been approved by the FDA as a treatment for depression. So psychiatrists can prescribe Spravato is like a nasal spray of ketamine
Oh.
and can be helpful for folks as well. But it's a different experience. It's not, you're not using that and then having this like deep psychedelic experience.
Mm. It's
It's,
when you're
yeah,
home, when you're struggling, or just in daily life?
you can just as prescribed by the
Mhm.
psychiatrist. Yeah.
Mhm. Okay, yeah.
So,
Yeah, that
so
makes
those
sense.
are the different ways ketamine can be accessed. And then, so if you're interested in something like MDMA or psilocybin, these are still illegal substances in the US. So at the federal level. So people want to keep that in mind. So right now, my recommendation would be if you go to clinicaltrials.gov, you can find clinical trials that are happening with psychedelics throughout the country and see if you might qualify or be eligible for one of those trials. That's another way. And then the other thing is so Oregon has approved or made legal psilocybin in controlled settings. So, for those of us who live here in Washington, that's another option as well. You have to go to what's called a licensed service center in Oregon, and you can go to these centers, and you don't even have to have a mental health diagnosis or any other kind of medical diagnosis, which is, I really love that about their model that people can access these things without that.
Mm.
And the service centers do screening and that sort of thing, but you can go experience psilocybin at one of the service centers in
Mhm.
Oregon. So that's an option. And then Colorado also approved a bill that they're going to set up a system that's somewhat similar to Oregon and making psilocybin accessible for the public as well.
So, yeah, it does sound like there's some options, and yeah, that to be cautious about what is available and what risks you're taking by accessing them in
Hmm.
different states. But the clinicaltrials.gov is interesting. The image that came to mind when you said that is like getting a I'm probably not gonna put edit point, but this is just for you. Like getting a permission slip, like daddy government is like allowing you to like
Hmm.
skip the
Yeah.
line some way. It's just
Yeah.
kind of
Yeah.
interesting.
Yeah. Yeah. So I do want to talk a little bit about what's happening with MDMA. 'Cause I think it's important for people to
Yeah,
know as
please.
far as access. So MDMA and psilocybin are the closest, I would say, to becoming legal forms of treatment by the federal government. And I want to say this because I hear a lot of, well, MDMA is going to be legal in 2024 and I'm going to wait and then I'm going to be able to access it. And I kind of want to temper people's expectations a
Oh,
little bit around that
uh-huh.
because MAPS has completed all the clinical trials necessary for FDA approval. And last I heard, by the time this comes out, and maybe it's a little changed, but last I heard, they are going to be submitting the application to the FDA for approval by the FDA at the end of this year, with hopeful FDA approval in 2024
Mm,
at some point. That could happen mid-year, that could happen end of next year, who knows? It'll be really interesting because the FDA doesn't regulate therapy. So this will be the first time that they, I think, will approve a drug in conjunction to be used in
mhm.
conjunction with therapy. So that's really interesting to me.
Yeah.
So, anyways, the FDA will have to approve this. Let's say they do this end of 2024 next year. Okay, so that has to happen. And then what happens after that is the DEA has to reschedule the drug because
Mm,
MDMA and psilocybin sit in Schedule 1 right now. And so they have to be rescheduled to be in one of them where there is an accepted medical use to be able to use it clinically.
mm,
I don't know how long that takes. I don't know how fast or slow the DEA is with rescheduling things. And then what has to happen after that is we have to have the infrastructure in
mm.
place to be able to offer these medicines safely for
Yeah.
people. And I think that's what you're kind of saying in these ketamine clinics is some of these clinics are popping up and they're offering ketamine, but they're also popping up in hopes of offering MDMA and psilocybin. So they might be a little more ready to offer those medicines, but then you also have to have therapists who are get trained in the model and certified, enough therapists to meet the need, enough prescribers who are knowledgeable to meet the need as well. So I still think we're a ways off from the public being able to access these in a legal setting. Yeah.
Mhm,
Yeah,
mhm.
I think we'll get there, but I think it's still gonna be quite a bit longer than people realize.
Well, yeah, even in terms of what you just said about the therapist being trained and ready to offer it, there's already such a
Mhm,
shortage in so many areas that for
mhm.
just regular therapy, talk therapy, that
Yeah.
to find the people to offer it might be also tricky.
Yeah, and I think too, I keep wondering if we'll see changes in the model at all. So the model that the FDA is gonna likely approve for MDMA assisted therapy, it's a combination of 12 hour and a half psychotherapy sessions spaced in between 3 8-hour MDMA sessions. And right now that has to be with a team of 3 people. One is a medical prescriber, the other is a licensed therapist. And I think that they got the approval for the other one to be a bachelor's level provider who has gone through the MDMA assisted therapy training.
Yeah.
But the other thing we have to think about as these things start coming online is cost.
Yeah.
So if you think about that, how much is that going to cost somebody? I'm honestly not sure how practical that is in the medical system that we have in America. So I'll be curious to see what transpires. I also think we need insurance to cover it. And I'm curious how the insurance industry, we
I'm
know
sure
how
they don't
insurance and mental health is. So I'm like really curious to see how they're going to approach covering psychedelic assisted therapy.
Yeah.
I don't think it's impossible. And there's this one company, I can't remember the name of it off the top of my head right now, but there's this one company I know it's a startup that's trying to offer psychedelic assisted therapy starting with ketamine as like an add-on for
Oh,
somebody's insurance. So it's something the employer could purchase to be able to get ketamine coverage for their employees if the regular insurance doesn't offer it. So that could be another way to go about that as well. Yeah.
oh yeah. That's an interesting like side way of combining the two. Wow, this is so much information. Anything
Yeah.
as we can start to wrap up, anything that we missed, anything that would be missing for anyone listening to learn right now?
Yeah, I mean, I'm really big on what we call harm reduction. So
Mm,
I really giving people information for them to take and to make informed decisions about how they want to pursue their own healing. So there's a couple just things I like people to know about. So dancesafe.org is an amazing organization. They do a lot of really good harm reduction work in the community and at festivals. They sell drug testing kits that are
mm,
completely legal. So somebody can go online and buy those. And so if they are somebody who's using something like MDMA or LSD, they can go buy those kits and then test them at home to make sure that their sources don't have something like fentanyl. And then the other thing I like a lot is a website called drugsdata.org. This is actually a legal drug testing lab where people can send in a small amount of their drugs with cash. It's completely legal, although the sender does not get their drug sample. And this lab will test it for you. So that's another way to know if your drugs are safe or not. And then I always like to give people some questions. If you're going to go access these medicines on your own, I know I have made a reference to guides before. I don't want to encourage people to access illegal drugs underground. But if somebody is really desperate and finds themselves headed that way, I think important questions for therapists that they can ask their clients or clients can ask others is, how did you find this person? Do you know
Mhm.
anyone else who has worked with them? Have they had any training? What is their experience? What are they charging you? Did they talk to you about things like consent and touch? Do they work alone or do they work with someone else? Will you provide the substance or will the guide? If it's the guide, have they confirm they've tested the drugs and are able to prove they're clean? Do people you're working with, do they provide any sort of preparation or integration? Where will the session be taking place? And did they do a medical screening? I think it's perfectly appropriate for therapists to ask their clients these questions and for clients to ask anybody they're thinking about working with those questions. Yeah.
Mhm. That's such a good resource because I think when we are talking about something that is illegal and anything that even on the spectrum of shame inducing or
Hmm.
privacy or just keeping anything that we want to hide, it can limit then this really important risk analysis that's happening of making sure that we are talking about the things that we can talk about or set ourselves up for having a protected experience with when it comes to consent and risk and everything
Hmm.
that you just
Hmm.
listed. So that's a really good resource.
Yeah.
Mhm. Any final resources? We can link things in the show notes so that we don't need to take a ton of time, but anything else we can pass on?
Yeah, I know I sent you some links for the show notes. So I would encourage people to check things out there. I will highlight Psychedelic Support Network. I think they're a really great resource. They're kind of like the Psychology Today of therapists who have had training and experience in psychedelics and psychedelic integration. So if you're trying to find somebody who has knowledge of those things, that's a great place to look. I also like it for clinicians too because they offer trainings, and some of those trainings are free as well. So they're a really great resource. And then I really like the Psychedelics Today podcast as well. I like a lot of the information they give and a lot of the resources they give there too. I think is helpful for both clinicians and therapists exploring these things. So
That's
yeah.
awesome. Thank
Yeah.
you. And then if anyone were to want to get in touch with you, or is there anything going on locally in Washington?
So I do provide consultation for both therapists and clients who have questions about psychedelics or have a client and they're not sure how things are going with it. I'm very open to consulting with people about that as well. There is some stuff going on in Washington. The University of Washington is opening a place called the Center for Novel Therapeutics. So they're going to be doing psychedelic research out of that part of the university. So that's really exciting. Psychedelics are also decriminalized in Seattle. So what that means doesn't mean it's legal. That's what I tell you. Doesn't mean it's legal. What it means is it has made the lowest priority for law enforcement. And so they're told to not go after it if they're found with somebody. So, yeah, but it doesn't make it legal, but they are decriminalized, which is a good step in the right direction. So,
That's great.
yeah.
And then
Yeah.
I saw too that the organization that you're co-president for, the Alliance, they're having
Yeah.
a training upcoming this next year.
Yeah. So in the fall of 2024, we'll be bringing in a psychoanalyst. Her name is Megan Rundle. She's out of the Psychoanalytic Institute of Northern California, which is Pink. And she will be coming to do a training next fall on ketamine and psychoanalysis. So that'll be a good resource for therapists who are interested in these things. Yeah.
That's really exciting because that was something that we didn't have time today to really unpack that connection between
Mhm.
psychoanalysis and
Mhm.
psychedelics, even though a lot of the themes that we talked about are, I'm sure, just
Yeah.
expanded upon what that will be. But that would be a
We'll
great
do another
resource.
Let's do another interview.
I know, part 2.
Yeah, part 2.
Don't tempt me.
Yeah.
Cool. Well,
Yeah.
thank you so much, Erin. I really appreciated talking to you. And I think this was just really good information as a starting point for anyone who's just been curious about what's going on with psychedelics.
Yeah. Thanks.
Yeah. Relational Psych is a mental health group practice providing depth-oriented psychotherapy and psychological testing in person in Seattle and online in Washington State. If you're interested in mental health care for yourself or a family member, please reach out. Our website is relationalpsych.group. Relational Psych is a mental health group practice providing depth-oriented psychotherapy and psychological testing in person in Seattle and online in Washington State. If you're interested in mental health care for yourself or a family member, please reach out. Our website is relationalpsych.group.